Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is opt-in and opt-out in healthcare.
1. What are opt-in and opt-out? Let's start with the basics. What exactly do we mean by opt-in and opt-out in the context of healthcare? These terms refer to the methods by which patients provide or withhold consent for the use, sharing, or disclosure of their personal health information, PHI. Understanding these concepts is crucial for both healthcare providers and patients as they navigate issues of privacy, consent, and data sharing. In an opt-in system, patients must actively give their consent before their health information can be used or shared for specific purposes, such as research or marketing. In contrast, an opt-out system assumes that patients consent to the use of their information unless they explicitly decline or withdraw their consent.
2. How opt-in and opt-out work in healthcare. Now that we understand the basic definitions, let's explore how opt-in and opt-out systems are applied in healthcare settings. These systems can be used in various scenarios, from sharing patient data with third parties to enrolling patients in health information exchanges, HIEs. Here's how they work. 1. Opt-in systems. In an opt-in system, no action is taken with a patient's health information unless the patient has explicitly agreed to it. For example, before a healthcare provider can share a patient's information with a research organization, the patient must sign a consent form stating their willingness to participate. Opt-in systems are often seen as more protective of patient privacy since they require explicit consent before any action is taken. 2. Opt-out systems. Conversely, in an opt-out system, a patient's information may be used or shared unless the patient takes action to prevent it. For instance, a healthcare organization might automatically include patient data in a health information exchange, but patients have the option to opt out if they do not want their information shared. Opt-out systems can be more efficient because they assume consent, but they also require patients to be proactive if they want to limit the use of their data.
3. Key considerations for opt-in and opt-out systems. Both opt-in and opt-out systems have their advantages and challenges, and it's important to consider these factors when implementing or participating in such systems. Let's take a closer look at some of the key considerations for each approach. 1. Patient awareness and education. One of the most significant challenges with both opt-in and opt-out systems is ensuring that patients are fully aware of their choices. In an opt-in system, patients need to be informed about why their consent is being requested and the potential benefits and risks. In an opt-out system, patients must be made aware of their right to opt out and how to do so. Healthcare providers must take responsibility for educating patients and providing clear, easy-to-understand information. 2. Ease of implementation. Opt-out systems are generally easier to implement because they don't require active participation from every patient. However, they rely on the assumption that patients will opt out if they have concerns, which may not always be the case. Opt-in systems, while more protective of privacy, can be more cumbersome and may result in lower participation rates because they require active consent. 3. Privacy and trust. Opt-in systems are often seen as more respectful of patient privacy because they give patients greater control over their information. This approach can help build trust between patients and healthcare providers. On the other hand, opt-out systems, if not managed carefully, can lead to concerns about the automatic use of personal data without explicit consent, potentially eroding patient trust. 4. Legal and ethical implications. Both systems have legal and ethical implications, particularly in relation to data protection regulations like HIPAA. Opt-in systems align closely with the principle of informed consent, which is a cornerstone of ethical healthcare practice. Opt-out systems must ensure that patients are given clear and accessible options to withdraw their consent and that their rights are respected at all times. 5. Impact on public health initiatives. Opt-out systems can be beneficial for public health initiatives that rely on broad data collection, such as disease tracking or population health management, because they enable more comprehensive data sets. However, these systems must balance the need for data with respect for individual privacy and consent.
4. Examples of opt-in and opt-out in healthcare. To give you a clearer understanding of how these systems work in practice, let's look at some examples of opt-in and opt-out scenarios in healthcare. 1. Opt-in example: research participation. When a healthcare organization conducts a research study, patients are often asked to opt in if they want their data to be included. This might involve signing a consent form that details the scope of the study, how their data will be used, and any potential risks. Without this explicit consent, their data cannot be used for research purposes. 2. Opt-out example: health information exchanges. HIEs. Many health information exchanges operate on an opt-out basis. This means that a patient's health data is automatically included in the exchange, allowing their information to be shared between healthcare providers to improve care coordination. Patients who do not want their data included must take action to opt out of the exchange, often by completing a form or contacting the HIE directly. 3. Opt-in example: marketing communications. Healthcare organizations must often obtain explicit consent from patients before sending marketing communications related to health services or products. Patients may be asked to opt in by checking a box or signing a form to receive these communications. This ensures that patients only receive marketing materials if they have agreed to it. 4. Opt-out example: organ donation registries. In some countries or regions, organ donation registries operate on an opt-out basis. This means that individuals are automatically considered organ donors unless they explicitly choose to opt out. This approach aims to increase the number of available organs for transplantation while still respecting individual choice.
5. Best practices for implementing opt-in/opt-out systems in healthcare. Whether you're considering an opt-in or opt-out system, there are best practices that healthcare organizations should follow to ensure that these systems are effective, compliant, and respectful of patient rights. Let's explore some of these best practices. 1. Clear and transparent communication. Ensure that patients are fully informed about their options. Whether you're implementing an opt-in or opt-out system, provide clear, concise, and easy-to-understand information about what the system entails, why it's important, and how patients can participate or withdraw their consent. 2. Accessibility. Make it easy for patients to opt in or opt out. This could involve providing online forms, phone options, or in-person assistance. The process should be straightforward, and patients should be able to change their decision at any time without hassle. 3. Documentation and record keeping. Keep detailed records of patient consents and any opt-out decisions. This documentation is crucial for legal compliance and for ensuring that patient preferences are respected in all aspects of their care. 4. Regular review and updates. Regularly review and update your opt-in/opt-out processes to ensure they remain compliant with current regulations and best practices. This includes staying informed about changes in privacy laws and technology that may affect how these systems operate. 5. Patient education and support. Provide ongoing education and support to patients about their rights and the implications of their choices. This could include informational brochures, website content, or direct communication from healthcare providers. Empowering patients with knowledge helps them make informed decisions about their health information.
6. The future of opt-in/opt-out in healthcare. As healthcare continues to evolve, the concepts of opt-in and opt-out will become increasingly important, particularly with the growth of digital health and data sharing initiatives. Let's take a look at some trends that may shape the future of opt-in and opt-out systems in healthcare. 1. Integration with digital health platforms. As more healthcare services move online, opt-in and opt-out systems will need to be integrated with digital health platforms, such as patient portals and mobile health apps. Ensuring that patients can easily manage their consents and preferences online will be key to the success of these systems. 2. Increased focus on data privacy. With growing concerns about data privacy, there may be a shift towards more opt-in systems, where explicit patient consent is required before any data is shared or used. This could lead to stronger protections for patient information, but it may also require more effort from healthcare organizations to obtain and manage consents. 3. Personalized consent management. In the future, We may see more personalized approaches to consent management, where patients can customize their preferences based on specific types of data or use cases. This could include more granular controls over who can access their data and for what purposes. 4. Regulatory changes. As data protection laws continue to evolve, healthcare organizations will need to stay informed about new regulations that affect opt-in and opt-out systems. This includes being prepared for potential changes in consent requirements and ensuring that their systems are compliant with these regulations.
Conclusion. In conclusion, opt-in and opt-out systems play a critical role in managing patient consent and protecting privacy in healthcare. By understanding the differences between these approaches and following best practices for implementation, healthcare organizations can ensure that they respect patient rights while efficiently managing health information.